Let's think about creatinine. So creatinine is a byproduct of muscle degradation. There's constant production from the muscle, and there's constant filtration by the kidney. All of which work to keep the creatinine in a very narrow range, 1.0 milligram per deciliter. As creatinine depends on muscle mass, patients who have low muscle mass may have low creatinine. For instance, an elderly 85-year-old female who is bedbound may have a normal creatinine of 0.5 milligrams per deciliter. A 30-year-old female should have a creatinine of 0.9 to 1.0 milligrams per deciliter, depending on her frame size, how tall she is, how much muscle she has, etc. That same 30-year-old female who is pregnant will have a creatinine that is lower, 0.8, 0.7 during pregnancy, because what happens is that the glomerular filtration rate increases and the volume, total body volume, increases. Increases in creatinine is almost always due to decrease in kidney function or decrease in glomerular filtration rate. Decrease in glomerular filtration rate can be acute in terms of acute kidney injury, so it can be acute, or it can be chronic. In terms of chronic, we have several stages of chronic kidney disease. Whereby the production is higher than the filtration or elimination. One other concept to recall is that not only is creatinine filtered, it is also secreted. Normally, if someone has a normal creatinine, it's about 15% of it is actually secreted in the nephron, with 85% filtered. Interestingly, as patients who have chronic kidney disease progress, the amount of creatinine that's lost through filtration declines, but the amount of creatinine lost through secretion stays the same. And so what does happen over time in chronic kidney disease is the actual percentage of creatinine loss through the nephron changes relative to filtration or secretion, all the way up to something like 30 to 40% secretion and 70% filtration. And so in some patients who have Bactrim, DMP, SMX on board, Bactrim blocks the secretion of creatinine. And so in patients with chronic kidney disease, what happens to them on Bactrim is that a large percentage of the creatinine that's normally secreted is blocked, and the actual serum creatinine will increase in a patient who has chronic kidney disease. So a patient on Bactrim with chronic kidney disease, or CKD, will have an increase in serum creatinine because we have blocked the secretion of creatinine due to the drug effect. Let's talk about the relationship between glomerular filtration rate and creatinine. Unlike most relationships in medicine, this is a curvilinear relationship. So in a young, fit male, creatinine clearance, or GFR, otherwise known as creatinine clearance, is going to be in and around 100, 120, and that person should have a creatinine of 1. In a patient with change in creatinine, this is considered normal. A patient with a change in creatinine, say the creatinine has gone from 1 to 1.5, you're going to have approximately a 40% decrease in kidney function, down to a GFR of 60. If that creatinine goes to 2, you've dropped down to 40%, or 40 GFR. As that creatinine continues to rise, what you see is a blunting of the change. So the most important thing to note is that there's this radical decline in glomerular filtration rate as the creatinine goes up. And as the creatinine continues to go up, the relative decrease in glomerular filtration rate is low. So there's this curvilinear relationship. Many times you will see patients with creatinines of 1.1. Then 6 months later you'll see them at 1.2. 6 months later you'll see them at 1.3. As you can see, if you have a patient who starts in your clinic on day 1 of internship with a creatinine of 1, and in a year's time they've gone to 1.3 or 1.5, they have lost 40% of their kidney function as they've declined, and it's happened right before your eyes. This curvilinear relationship is extremely important. It's extremely important to realize that if a creatinine goes from 1 to 1.5 or 1 to 2, you've lost a tremendous amount of your glomerular filtration rate.